for putting it in the chat, your introduction. So it looks like we have some people hopping on still. I'll wait a couple minutes to give everybody an opportunity. Hi, Lisa.
Hi. How are you, Angel?
I'm doing well. Thanks for joining us.
No problem.
Okay. Okay, we're going to go ahead and get started. So this is the local coordinating council, the Boulder County Local Coordinating Council. I'm going to go ahead and mute everybody. I know that we have, one moment, sometimes it mutes me when I mute everybody. Okay, can you still hear me? Thumbs up? Okay, great, wonderful. So it's great to see so many faces. I really appreciate you joining the call today. I know that we have some other people who are hopping on. We have a pretty full agenda today, but I will go ahead and start sharing my screen. I do want to introduce a new Mobility for All team member. Aiden, do you want to unmute yourself and just introduce yourself real quick?
Sure. I'm Aiden. I'll be working with Angel and Anna as a public engagement specialist. I just started a couple of weeks ago and I'm excited to be in this meeting and meet everyone.
Yeah, we're really excited. I know he works with community cycles as well. So just really excited to have him on board. And we heard nothing but good things about him when he was doing bicycle training with the Boulder County Housing Authority residents. And that's one of the reasons why we selected him, is how he was carrying out those education platforms. So now we have 3 people on Mobility for All. Those of you who weren't aware, I split Daniela's position into 2 separate positions. And so now we have Anna Colon and Aiden Johan. And so I think that we're doing well. Everybody's getting onboarded and we're getting ready to start running again. So we're excited. So I'm going to go ahead and start the presentation and sharing my screen. Okay. Okay. So this is the June 8th Local Coordinating Council, and I'm just going to talk a little bit about some housekeeping with Teams. I know most of you probably joined using the Teams link to join either in your web browser or in the app. If something does happen in that meeting invite, there also was a phone number. So if you get kicked off for any reason, please feel free to call in on your cell phone, and there's the conference ID. If you call in using your cell phone, usually if you just click on the phone number, it will automatically have the conference ID that will dial after a little bit. You see these commas, it kind of builds in the pause. And so you don't necessarily have to enter in the conference ID separately. Additionally, I'd like to talk about some of the features of Teams. So video does help with communication, but when we have a slideshow going, it's hard for me to see everything that's going on. So please feel free to raise your hand or put a comment in the chat box if I don't see somebody. So please try to, and that's what it looks like. Usually underneath the presentation, you'll have little pictures if you have your video going. And then also please mute yourself. I already muted everybody, but if you do unmute yourself to chime in, please feel free to do that. And then mute yourself again after you're done. I'm really trying to balance the efficiency of running one of these meetings online and then also making people feel like they can speak up and feel engaged. So this chat function right here we'll bring up this new message and you can see links, share links, and see what everybody else is talking about. And then also, if you click on this meeting, this participant icon, you'll see everybody who's in the meeting. And again, I am recording this meeting for the meeting minutes. And we have talked internally about possibly posting these online just to have a little bit broader reach. If we decide to do that, we'll let you know. So the local coordinating council, we meet every month. We meet on the second Monday of the month. And due to COVID, we're going to have virtual meetings for quite a while. This was a picture from one of our meetings in Longmont. We have had a little bit broader reach by offering them online, but I do feel like there's some of those synergies, those collaboration points that we miss. So I'm open to any suggestions on how we can kind of get those informal networking collaboration pieces acknowledged in the virtual format. So the purpose of the local coordinating council is really to bridge the human services and transportation. And we really do focus on transportation being like a social determinant of health and an essential service to access all other aspects of your life. We do focus on multimodal. So we are looking at transportation options to get people up into the safe and thriving section. This little graph at the bottom is the self-sufficiency matrix that HHS uses when they're evaluating how stable families are when they're intaking. So we really want to get people to the stable, safe, and thriving areas with transportation through multimodal options and through backup and resilient transportation ecosystems. I would like to acknowledge that COVID-19 pandemic is changing a lot how people are traveling, and we want to have our finger on that pulse. And that's part of the key of that is asking you to talk to your clients and see what their barriers are. And then this is the forum for you to let us know how people are changing, their needs are changing. And then also one big thing that I would like to address is that the pandemic and the Black Lives Matter situation is really exposing a lot of inequities. And with us as a group, we're focusing on equitable, affordable, and accessible transportation options. And we need to acknowledge the role that transportation plays in inequities in our society and how we can be part of the solution and helping have a more equitable society. So just keep that in mind as we progress. And if you have recommendations on how we can be more equitable, please don't hesitate to share that with us. We're open to hearing your concerns and issues surrounding inequities that we are currently experiencing. Also, a lot of transportation providers are transforming how they deliver services. So we saw this with, Via and Access-a-Ride delivering groceries to people who weren't able to leave their house. And then there's also, of course, increased cleaning and disinfection requirements with the COVID pandemic. Here is our agenda today. We're going in the welcome right now, and then we'll have some updates from Cultivate. I did not tell Dr. Mack that we would do an update, but I was going to talk a little bit about a program that they're launching. Ego Car Share, Lions Z-Trip Voucher Program, the Lafayette On Demand Services. I did find out just before this that RTD won't be providing an update, but we'll try to get a more robust update from RTD at the July meeting, because there's a lot of changes that are going on and their financial situation has been hit pretty hard with the recession or the potential recession. We're also going to get an update from Via Mobility Services, and also Zoe's going to talk about their rider survey that they recently did. And then we will talk a little bit about grant application coordination, because there's quite a few grants that are open and are closing within the next month or so. And I just wanted to get your ideas on that and see if there's any synergies that we can, any opportunities to collaborate and coordinate our grant application efforts. So this month, we're not necessarily going to all unmute ourselves to do introductions. I'm going to ask that you put your name and your organization in the chat function, and I have it highlighted in red right here. This is just to save on a little bit of time. I do want you to feel comfortable unmuting yourself and speaking up, raising your hand if you have any questions or issues throughout this, because it is hard for this type of a meeting to be a one-way. just kind of broadcast, because the intention of it really is to get that dialogue going. So I'll go ahead and start with the first update. So let me see if we have a Dr. Mac member on here. So I don't see Dr. Mac right now. So Dr. Mac has been updating all of the transportation provider information for the region.
Angel?
And they've, yeah.
I'm here. Malia Munson.
Oh, hi,
I'm
Malia.
here. It's
Sorry,
Dr. Mac. Yeah, that's okay.
I can't see the list when I'm on my computer, so I was looking on my phone. So Malia, I don't know if you just want to talk a little bit about how you guys have been updating your spreadsheet.
Oh, sure. So Dr. Mac, as we went into the quarantine time, decided to throw up another page on our website. What we're doing right now is as of right now, we're doing it at least twice a week. We are contacting all the providers from our Getting There guide, just to make sure we have up-to-date information, whether their, hours of operation have changed, or, some of them have just been doing delivery of meals and things like that instead of their regular transportation. So we've been trying to, on this page, the transportation updates page, trying to keep all riders as well informed as possible with those changes during COVID. We're still doing updates twice a week at least. Probably mid-June, we're going to move to every 2 weeks, just because we're starting to finally see a little bit slow down with how things are changing. And those providers are also getting a hold of us if anything is changing. So that is really an up-to-date, almost daily service for our riders.
Right, thank you. And I did include that link in the agenda newsletter that I sent out last Friday. So you'll see that Dr. Mac link right next to the events, I believe. Also, I wanted to just mention the fact that Carol Buchanan from Dr. Mac has reached out to me saying that they have free Uber trips that are available, and there's not any demographic restrictions on who can receive those Uber trips. So if you have clients in need, please let me know. I'm putting together just a little email update to you all specifically on this so that you know how to specifically request them. And as I understand, it's limited to one $25 trip, so per person. And if there is more of a need other than just one trip, then we can talk about possibly providing additional support through Mobility for All. So just wanted to let you guys know that that is an option. And Malia, I don't know if you know how long that pilot is going to be lasting.
We have those coupons available through the end of June.
Okay, so coming up here pretty soon, right? Because we're in the first week of June. So
right, and just as a clarification, if somebody has a round trip, that $25 only counts for one way. So we can give out 2 coupons, one to get you there, one to get you back.
Okay, got it. Great, thank you. Okay, so yeah, if you have anybody that's in need, Malia, just so you know, and you can let Carol know, I did talk to SUMA, which is our bilingual, bicultural brokers program. And I'm putting together an email for them so that they can talk about it with their cultural brokers. This could be something that would be of use to them because they're looking for resources that are available to people regardless of documentation status. So we had talked about that.
That's fantastic. I'll pass that on.
Okay, thank you so much. Does anybody have any questions for Malia or for me regarding Dr. Mac's updates?
Can I ask another question about the trips?
Yeah.
This is Rashan from SPAN. Sorry, thank you. I'm wondering about what kind of client information. I know you mentioned documentation status. Do they have to give their name and ID? I mean, what kind of information has to be shared?
Sure. I didn't know I was going to be asked questions. I can get that information for you if you just wait 1 second. I know that
I'm sorry.
they do.
Thank you.
No, it's totally okay.
No, I put it on the agenda without letting her know. Sorry.
And that's okay. So I know that they are asking for names. But Kate has been talking to some people. Okay. I've got it pulled up here. So they want to know. So it'd be your agency would be on this information. And then how did you hear about the offer? They'd like a first and last name, which I have talked to Kate about because some people don't want to provide that. And honestly, what this data is for is basically showing Uber that we've gotten out there and have gotten these, codes to different people. So if you truly felt like that rider was uncomfortable giving that information, if you just put a name in there, there's no way they're going to get callbacks, and they're not checking up on this information. It's really just to show that we've utilized this program efficiently. So you could put any name in there and that would be okay. And then it's just wanting their primarily their age, and the county and zip code, and the purpose of the trip is really what they're looking for. We're trying to see within our MPO where people are needing trips to and from during this time.
Okay, thank you. Yeah, thank you so much. I'm actually more interested in thinking about just the fact, like, if people know that they're attached to our agency, then so
Yeah.
needing a release and kind of the privacy on that end. So,
Yeah,
okay.
we've been really careful about HIPAA and things like that, with the questions that we've been trying to ask and the data we're trying to gather.
And also we can just put the request for mobility for all, and it wouldn't necessarily have to be SPAN, just
great.
because Carol had reached out to me about like mobility for all being like the coordinator for it. So I don't see any reason why we couldn't just put mobility for all.
Oh, I love that. Thank you both. I appreciate it.
Great. So any other questions about Dr. Mack before we move on? Okay. So next we have, next we have Ego Car Share, and I didn't see, let me check to make sure Peter's on.
I'm here, Angel.
Okay, wonderful. I'm gonna go ahead and pull up that slideshow that you had sent me previously.
Oh, great. And I don't know if it's easier for me to share a screen or if you have that at your hands, Angel.
I have it available. Either way, it might be easier for you to share if you are ready, but we're good right now, I think. Can you see?
Yep, I see it now.
Okay.
I assume everyone else can as well.
Okay.
Great. All right. Thanks, Angel. I appreciate it. Hello, everyone, and apologies in advance if the dogs start barking. That's one of the nature of these strange times that we live in working from home. It's a little bit of a mixed blessing. So yeah, we have some interesting updates that Angel had asked me if I could provide an overview of them. For those of you who may not be as familiar with Ego Car Share, I just have a few kind of overview slides as well, and then I'll get into a couple of the updates. You can go into that second page there. So yeah, basically with Ego Car Share, we have a couple of, we have sort of a two-pronged approach. We have our, the mission-driven side as a nonprofit, which is basically education, outreach, and advocacy around promoting and providing affordable, socially equitable, basically non-single occupancy vehicle mobility options. And then the other tier of what we do operationally is that we have a fleet of about 50 vehicles around Boulder County and Denver that are in essence basically neighborhood vehicles for our members, who we have about 3,500 across the metro region, to use 24/7. You can go ahead and move into the next one. So as you can see here, this includes really connecting what we do from an education standpoint and operationally in terms of where we station our vehicles with complementary mobility options nearby in tandem with our partnerships in low to mixed income communities, working with Boulder Housing Partners, Denver Housing Authority, et cetera, partners such as that. And then educating folks so that they know that they have these public transit and or other micromobility options nearby. Okay. This is just, oh yeah, this is just sort of connecting the dots that on how we quantify the impacts that we're having around public transport, biking, walking, reducing single occupancy, vehicle ownership, carbon emissions, things like that, to really make sure that what we're doing when people become a member and use car sharing has other mobility benefits as well. Next. And this is, yeah, just to give you an overview to show you where we're at all around Boulder, also in the Denver area, as well as we have specialty vehicles, a lot of hybrids, but also all-wheel drives for people that want to get into the mountains, trucks, etc. Okay.
So you no longer have the vehicle in Longmont, is that correct?
Oh, we do. Yes, we do have our vehicle in downtown Longmont as well. And happy to say, Angel, that that car has continued to improve. That location continues to improve. So we're really, really excited about that.
Great.
We're also currently working to electrify our fleet so that we can continue to enhance the benefits and hope to be the state and the country's first EV car share organization. So that's been super exciting, if not a fun roller coaster ride. Okay. And here's an example working in the Mariposa district in Denver, where we have launched with the city our first electrified car share dedicated location, including a car share charging station that is also available to the public in a lower income affordable housing area. Okay. And yeah, just in terms of updates, it's been pretty interesting, as you can imagine, as RTD's experienced, as pretty much everyone else's experienced. We took a pretty massive hit with the current health and economic crisis. So much so that it was, it was a pretty scary space for a while. But one of the things that we did discover through that process, or at least was reaffirmed, was the fact that we are a lifeline mobility need, fulfilling a lifeline mobility need for a number of, particularly our more vulnerable population, including in lower income areas, affordable housing, and older retirement and fixed income communities. One of the, and then this just kind of shows in response to that, some of the work that we've been doing, which has been significantly enhanced cleaning, sanitation, and in particular communicating with our members so that they're better prepared for being a participant in car sharing during the crisis, and helping our entire membership base and community to be healthier and safer during that. We've also developed and implemented certain specials, prepaid credit opportunities, bringing together weekly rates where, for example, people could keep the vehicles at their home and not be sharing it, for example. Some new rate plans that we're about to launch. And then we've also recently received some grant support to allow us to offer free credit for medical and healthcare, frontline workers, volunteers, and we're about to launch another program where we can offer credit for older adults living in affordable housing communities. So if that's something that is worth reaching out to any of your constituents or any way we can connect and help to support that, don't hesitate to let me know. Okay, and oh, that's just a brief video to kind of show how we work with our communities. I don't know if you can activate that, Angel. If so, great. If not, no worries.
Can you see it?
Looks like it's pulling up. Yep.
I'm just make sure that we can hear the audio, because I'm not sure how, I've never shared video over this before.
I don't hear the audio.
Can you hear it? No? Okay. So I will send this out then so that everybody can watch it, and I will also include it in the chat box so that you can watch it after the fact.
Great. Awesome.
Great.
Happy to answer any questions. Otherwise, thank you for your time.
Thank you. And so just to clarify, Peter, if people have volunteers that could use it, or people who could use it for their medical appointments, they would just contact you to be able to connect their clients with that information, correct?
Yeah, they can just call our main line on our website or email info@carshare.org for me, and then we'll help them out.
Okay, great. And if you could put that information in the chat, that would be really helpful as well.
Yep, we'll do.
Great, thank you. Okay, so I think that we were going to have Katie from Cultivate give an update. Katie, are you on the line?
I'm here. Can you hear me?
Yep, we can hear you.
Okay, great. Yes, this is Katie Ellenwood with Cultivate with the Vets Go program. This is my first time attending this meeting, so I'm glad to be here. So I just had a quick update on the rides, the Vets Go program. We have been operating as normal since the pandemic. Just had fewer rides, obviously, with the medical appointments being canceled. We've mainly been doing critical rides, like a lot of dialysis clients getting their weekly appointments. We've had about, let's see, we've had much less rides. We've had about 240 rides between March and June, and a total of 680 from January to now. So it's definitely been maybe a third less of rides, or to a half the amount of rides due to the pandemic. But we've been pretty much operating as normal with adding sanitizing, and or asking the drivers to, wash their hands and use hand sanitizer. And we've been offering masks and hand sanitizer, and asking the clients to sit in the back seat. I think that's it. Yeah. Do you have any questions?
I have a question. Has there been a change between the trips that you take to Cheyenne versus the ones that you take to Denver's hospital?
We still offer those rides. We've had a couple clients that have asked to go to Cheyenne, but not very many. And it has been a little bit challenging. We had one client who needed to go to Cheyenne this last month, and he wasn't able to get a ride. I think just because we've had less volunteers feeling comfortable driving, because we've had those volunteers are more in the at-risk population. So yeah, we don't have too many more. Mostly our Aurora rides, Aurora VA and Golden, and then Longmont, Boulder County, and then Broomfield area medical appointments, your typical doctor's appointments, and then dialysis rides. Yeah.
Yeah, great. Thank you.
Yeah.
And so I know that this isn't your area,
Yeah.
but the carry-out caravan has been going really well, right?
Yes.
Yeah, you guys have had a lot of business, and that's basically the grocery shopping or the
Yes.
grocery pickup service.
Yeah, shopping and delivery. So we've, I don't have a lot of information because I wasn't planning on talking about that program, but we have probably tripled or quadrupled our clients and orders from March, April, May till now. And we opened up a carry-out caravan program in Broomfield at the King Supers there, and that's been going really well. Yeah, we've been serving lots of clients, so we've been very busy, but it's been really, really great to be able to help our community get groceries right now, especially with a lot of the retirement communities, on lockdown. And so, yeah, it's been busy, but good.
Yeah. So Dinah in the chat says, "Thank you for the new Lafayette route."
Yes, I see that. Yeah, I know.
Great.
It was glad we were able to finally get some drivers to get to Lafayette.
So this is not your area, and I just thought about it when you were talking, but I'm pretty sure that you all can pick up SNAP orders for people, right? Basically the Supplemental Nutrition Assistance Program, which I know has been a barrier in some different communities. So you're not supposed to, just so you all know, like if somebody has food stamps or SNAP, they're not allowed to transmit their PIN over the phone. It's like a security issue. So the government agencies aren't supposed to promote it. But I know that there are a lot of places that are kind of doing the workaround to help people who are low income and on food stamps get groceries.
Okay.
I'm
Yeah,
pretty sure you all are, but yeah.
we are. Yeah, we do accept the SNAP cards and the EBT food stamp cards. Yeah, we have quite a few clients that use those for groceries. But yeah, no, that's a good point with the PIN number. Yeah.
Yeah, great. Well, thank you so much, and I
Yeah,
appreciate it.
thank
Thanks.
you.
Welcome to your first LCC meeting. We hope to see you
Thank
at
you.
future.
Of course. Thank you so much.
Thank you. Okay, so Lisa, I know that you're on the line here. If you wouldn't mind talking about a new partnership that Boulder County has with the town of Lyons?
Sure. Hi. Yeah, the Z-Trip voucher program was initially developed in coordination with Boulder County. They offered funding to help replace the midday bus service that was canceled between Lyons and Boulder. And now all our bus service is canceled. There are no buses anymore. So this is hopefully going to be a very helpful program. It's a weird time to start something like this because a lot of people are scared to use a rideshare service like Z-Trips. But we started at the end of April, and so far we've had about 100 vouchers that have been used, mostly for people commuting to work that would have taken the bus previously and now don't have that option. We've also passed out vouchers for use to get to and from medical appointments, social services, and running errands such as groceries, pharmacy, that kind of thing. These vouchers are available to any Lyons resident or employee, Lyons area resident, I should say, or anybody who works in Lyons that could use them. The initial idea was to make them broadly available so that anybody who might have used the bus could apply and use them. We have a short questionnaire that we ask when people are asking for vouchers, just to kind of help us track what they're being used for. And that was at the behest of Boulder County. They want to get some data on this and how it's working and functioning. Let's see, I'm reading my questions that you sent me. In terms of being able to track these, we're tracking right now on a Google document. There are only 4 places in town where the vouchers are available. One is at the town hall. We also have our Lyons Emergency Assistance Foundation that has a food pantry once a week. They're available there as well. We have caseworkers with the Boulder County Area Agency on Aging and the Hour Center that we give them to clients who they know could use this type of service. So that's how they're being dispersed at this time. We've been advertising on social media and through our town e-blasts and things like that to get the word out, to let people know this program is available. It's been in the town newspapers, and we're getting a little bit of response. Our goal was to reach out to people that don't have alternative forms of transportation, like many seniors maybe who are no longer driving, that kind of thing. And at this point, very few of those people have actually requested vouchers because, as I stated before, I think a lot of them are nervous about using this type of service right now. Let's see. So yeah, the initial reception of the program, I feel, with the fact that we've only been passing them out since late April and we've passed out about 100 that have actually been used, I think that's pretty good. Lyons is a small town. So I do know there are probably many more people who could use this, and probably will as restrictions ease and they feel a little more comfortable being out in public. I think we'll start seeing more requests. This does have it's a $25,000 funding that was provided by Boulder County. So in terms of that, we're tracking pretty well. If we start giving out huge amounts of vouchers, we're going to run out of money before the end of the year. So I think we're tracking to probably use it all, which is good.
Great. And just so you know, there was one of the participants of the Peak Ride volunteer driver planning group. I had a meeting and I was going to invite him to attend the meeting. He was an older gentleman, and he was so excited to be able to use his voucher. It was like the first time that he was able to use it, and he's like, "Sorry, I have a doctor's appointment in Longmont. I'm taking a Z-Trip voucher." So I was excited to like hear that it was already being used. So
It is. Oh, and I saw the service area. I forgot to address that. So the original intent was to replace the midday bus service and then the bus service between Lyons and Boulder. And then Boulder County very nicely offered to include Longmont in the mix. So now, even though there hasn't been a bus between Boulder and, between Lyons and Longmont for years now, they offered to include that, which is great because a lot of the locals here, go to Longmont for their doctor appointments and things like that. So the voucher is good for a one-way ride. It's got a maximum value of $45. So if a person is going, say, too far South Boulder, they might go over that $45 limit and would then have to pay the difference themselves. But it can take you anywhere within the city limits of Boulder or Longmont or Lyons, but not between Boulder and Longmont because there is already bus service covering that.
okay, great. Well, thank you, Lisa. I really appreciate you taking the time to give us the update, and I hope that the service is really well utilized. Does anybody have any questions for Lisa about the voucher program? Okay, so if you hear of anybody who's a Lyons resident and they don't need transportation, definitely send them Lisa's way. Thank you so much.
Yeah, thank you.
So I do want to take this moment to just remind people to put your name and your organization in the chat history, in the chat box. That way I can keep track of who attended and like what our reach is. So this really helps us with like grant reporting and knowing the impact of the local coordinating council. So I will just give a couple quick updates. So we still have not launched the RFP, the request for proposals for the strategic plan for Mobility for All, but we are almost done with the program evaluation. Our goal is by the end of June to have a program evaluation done, and I'll be presenting the results of that program evaluation probably at the July meeting. And I just want to thank everybody who was interviewed or who took the survey that we sent out. That really helps us to know how to dedicate our resources, our limited resources, and then also our time. So I really appreciate it. And then also the technology education workshops in June this week, we're actually starting to do refreshers for people who have already attended the Lyft and Uber workshops. And the reason why we're doing that is because we need to work out the glitches of offering it online. So starting on Wednesday, actually, we'll be offering Lyft, and then we have 4 kind of trial online education workshops. And if anybody here is interested in just attending those, let me know, and I can send you an invite for those. It's for people who have a little bit more familiarity with technology at this point, just because the intent of it is to give us feedback on how we're doing. And then starting in July, we will be offering the workshops, the technology education workshops to the general public online. And I do think that we are going to be prioritizing rescheduling a lot of those senior center sessions that we had scheduled before COVID online as well. And I know, Dinah, you had sent me an email. I'll get you some information on those dates that you had sent me. If you have anybody else here, great. And Lindsay said that she'll promote it in the July newsletter or their communications. So that would be great. Thank you. And I will be following up with all of the senior centers that we initially had them in the catalogs for the spring and summer, and try to get some virtual sessions scheduled in the fall. So next, I'm going to turn the presentation over to Scott, but I first wanted to say that this is really exciting because this idea for the on-demand service in Lafayette has been talked about for quite a while. And we had a subcommittee, and Dinah and a lot of you all were on that subcommittee where we talked about East Boulder County transportation gaps. And those discussions really were able to give us like that collaborative lens to submit the grant application for this. So I'll go ahead and turn it over to Scott, and I'll be controlling it, Scott. So just let me know when you want me to advance.
Okay, great. Thank you, Angel, and hello, everybody. I'm really happy to be talking about this new service. Like Angel said, this has kind of been in the works for a long time. It started back in 2006 with our Boulder County Transit Enhancement Plan. It was identified there, and then in the 2015 Transportation Needs Assessment. You can go to the next one. This slide is from the needs assessment, and it's the Transit Propensity Index. And as many of you guys know, that this is kind of pulling data from multiple sources. So you have low-income households, seniors, folks with disabilities, no car ownership, so forth, and they combine all that together. And you can see down in Lafayette how there really is a hot spot, even though there's not great transit. So next, if you look at where the existing used to be called call-in rides, now they're called flex rides, where those are, there's kind of a gap there, right where Lafayette is. And you can go to the next one, Angel. So what I did on this slide is zoomed in a little bit, and next, and then this is zoomed in on kind of the Transit Propensity Index. And then the next one, I overlaid them the two, and you can kind of see how there's call-in ride services or flex ride services, but not in Lafayette. So I know that Brian Matthews and others at RTD have been really wanting to do this for a long time. So last year there was Dr. Cog for the first time had a human service transportation set aside. So we decided to go after it to see if we couldn't find some funding to get this started. So that was the origin. It's the crux of the boundaries is going to be Lafayette. We know that there needs to be some deviation to this. This map that you're seeing here was actually what I put in the RFP to advertise a service for a transit operator. The intent is not to be exactly where the service will go. For example, we know that Kestrel is just off to the left there. That's not technically included in this, although we expect to include that later. But we did want to include as much of Lafayette as we could, including the hospital. And so that's where we are right now. I think as we move forward and start the service, we are going to be kind of tracking where people are asking to make origin and destinations so that if we need to expand this, we can. And I'll talk a little bit more about that later. So next. So there's going to be one vehicle. It's essentially an on-demand service. VIA actually runs those other flex ride services that you just saw. There was actually 5 different agencies that competed, that applied to the RFP that we sent out. So we were actually kind of surprised. But you can't beat VIA's familiarity with both what the service is like and also the clientele. So our selection panel went with them. We have funding for 12 months of the service. It's going to be 7 days a week, and the hours we're going to run are from 7 a.m. to 8 p.m. Monday through Sunday, every single day, so Saturday through Sunday. So we will be utilizing VIA's call center, but in addition to that, there's a new service that VIA is partnering with called Pantonium, and they have a web-based presence, but they also have a mobile app. And so we're excited, and VIA is excited to kind of get them started to see exactly how this can be used. We think the tracking software is going to be really good. You can also see where the vehicle is in real time, which I think is an advantage. So you're not just calling in and saying, hey, do you think you could pick me up? You can actually see where the bus is on a map and say, hey, I see it's coming this way. Maybe I can jump in. So you can kind of self-coordinate as well too. So that's a real advantage. If we ever moved, we have one vehicle funding for one vehicle now. If we ever move to 2 vehicles, there's also the software does some really good kind of back office. What's the word I'm trying to look for? Kind of like scheduling and operational efficiencies with more than one vehicle. So we're excited to use VIA and Pantonium, but I think VIA is also excited to try this new software too. And it's fare free. So we had the option, Dr. Cog gave us the option to go for fare free, and we said, yeah, we should do it. So it's fare free. Part of that is because the intent of this service is really through the DRCOG set aside is really to focus on low incomes, person with disabilities, and seniors. So that's obviously a component. But because it's not RTD, and we do think it can be used as a first and final mile to get to and from RTD services, we certainly didn't want to charge people twice where you have to pay to get on this service and then pay to get on your regional route. So, so we're really excited to have it to be fare free, and we think that's going to help too. So next. Like I said, there was a human service transportation set aside that's paying for 50% of it. And then the Boulder County Transit and Trails sales taxes, the local match, and that's paying for half of it. One of the grant opportunities that Angel mentioned is a second year of this HST. Applications are due in mid-July, and we fully intend to apply for a second year. In our letter of intent that we already submitted, we noted how many transit services really need at least 2 years for people to know about the service and to change their habits and so forth to get used to it. So we really think 2 years is kind of the minimum that we need to see if it's successful. So we are going full steam ahead with that in mid-July. I should mention too that the service is completely open to the public. You know, we are focusing on the disadvantaged populations, but it is open to the public. Anybody can use it. So there's no income qualifications or anything, and there's no questions asked when you schedule a ride. So next. You know, one of the things that we often hear about is that the boundaries of these flex rides are kind of artificial. They're political boundaries. And for humans, they're trying to go from one place to the other. They don't really care where Lafayette starts and Louisville ends. And we recognize that. And on the next slide, there's a map that was made by through the needs assessment. And you can get a sense here, Lafayette's down on the bottom right here. You can see a lot of people are going other places. Everyone's going somewhere else. And so we don't want to artificially restrict mobility of people that may be wanting to start in Lafayette and go to Louisville, or start in Lafayette and go to Superior, or vice versa. At the same point, you can't have just one vehicle going all over southeast Boulder County, because then it would be stretched too thin, and the likelihood of a new person calling in to get a ride would be like, well, we can get to you in 5 hours because we're clear across the county. I'm saying all this because I think after about 6 months, I think there's one more slide here, Angel, in about, oh no, not yet. In about 6 months, we are going to have kind of a broader look at the southeast, the whole southeast area of Boulder County, and whether or not it might make sense to join some of these flex rides, Superior, Louisville, Lafayette, Broomfield, so that maybe it's a larger area, and instead of having one vehicle each, we might have 4 vehicles each, or 4 vehicles for the whole area. So that's something that once we get some data about how these folks are using this, that we'll revisit, and we may be coming to the LCC to ask for your help and input on what that might look like. So the name, we can't call it the Flex Ride apparently. RTDs doesn't want us calling it the Flex Ride, and it may be confusing anyhow because it's fare free, and you're not calling RTD, you're calling, you know, via or these other numbers. So we could call it on demand, we could call it door-to-door service, call and ride, or Angel's favorite, the Russian chauffeur, pick-up drop-off. So we're not sure what to call it, but we would like your help. And we were going to have a little survey live in this, but I got scared of the technology. So I think we'll put together maybe a few questions to send it out to you of what should we name this thing that's intuitive to folks, including in that is the geographic area. Should we call it Lafayette? Should we call it Boulder County? There's positives and drawbacks for all of those. So we'd love your help on that. And also with your help, getting the word out. So we have hired Commuting Solutions, and they're going to help us with some print materials. And I'm meeting with VIA on Wednesday to kind of hammer out the last little bits of logistics. We don't have the actual call number yet or the website set up yet, so it's a little premature to be putting out materials, but I'm really hoping that's going to be coming in the next couple of weeks. We're looking to start the service by mid-July. And it would be great to have help from this community, the LCC, to help us get the word out and really educate this. Like I said, we do have some budget and to help with that, but it'd be great to have all y'all's help too. So I think that's it. Is that it, Angel? Is that the last slide?
Oh,
yes, that
there's
is
your
the last
contact.
slide.
And also
So,
we have a couple
yeah,
of questions.
Yeah,
Oh.
of course.
So Dinah had asked when it goes live, but I think you addressed that. So we don't know an exact date, but it's going to be, the goal is mid-July.
Yeah, the goal originally was July 6th, and we might still get up to that, but I think VIA needs a little bit more time developing I call it pandemonium. It's and it's not Pandora or pandemonium. It's
or plutonium.
Or plutonium. Yeah, that's Pantonium.
There you go. Zoe's on.
Pandemonium. I'm just gonna call it pandemonium. They need a little more time setting up that platform, but yeah, I think by mid-July we'll be up and running.
So Zoe says even they call it pandemonium too. So I'm sure it has a different meaning for you all as you're trying to get it set up, right? A lot of chaos going on right now. But this is really great. It's a wonderful expansion. And also, Dinah had said that the Senior Center would be happy to get information out through the Lafayette Senior Services. So perhaps we can also talk about getting a advertisement in your catalog. I don't know if you have a timeline, Dinah, when the catalog is going to go out to Lafayette residents. I also see a lot of very soon, she said. So I don't know if we are going to have content through Commuting Solutions to get put in the catalog, but that might be a really good way to get it started. Also, Lindsay, for the AAA newsletter, the Area Agency on Aging newsletter is also a good way. And then also, Zoe can't wait for a brainstorming session. Yeah, so great. We have some wonderful contacts. And then also through Josephine Commons and Aspinwall and Villa West, like those are all like Boulder County Housing Authority residence locations that we can promote it through as well. Oh, I'm sorry, Michelle. What was your question?
I think Michelle was asking if it's free now, but maybe it won't be in the future. Do we need to disclose that? And that's probably a good idea. If we win the grant for the second year, it would be free the second year as well. But we don't. But it's a good point about as people change their kind of trip behaviors and expectations of it, we need to make sure that we're clear about what the future is like. So.
Yeah, it is a good point. Okay, so do we have any other questions that I missed in the chat here? Okay, I think we're good. Thank you, Scott. I appreciate it.
Thank you, Angel.
Okay, so does anybody else have any other updates before we move on to the VIA update and writer survey? Any organizational updates that you have been experiencing? Any transportation gaps that your clients have been experiencing? I hear Bear Ride. Sorry, I'm still reading off the names. Okay, great. So I will be reaching out, and I have heard from a couple of the senior centers about doing virtual sessions and scheduling it in their catalogs. So I'll keep that in mind. Okay, so next, we did have an RTD update, but RTD they felt more comfortable if their communications staff provided it because there's some grim news surrounding the budget shortfall. And I don't know if Kathleen is on the call or anybody else who would feel more comfortable giving this update, but through the Reimagine RTD process, we've heard that they're planning on keeping the reduced service hours, so Saturday service hours, for a lot longer than what we all were expecting. So we will schedule RTD to talk to us about what that means for the July session. Natalie just didn't feel comfortable giving that update to the group. She wanted Pauletta, their communications GM, the AGM, to be able to give that update, or somebody in the communication staff. So just know that it's not great news for transit longer term. Just the economic downturn has really impacted their budget. I don't know, Scott or Kathleen, anybody else have any other comments on that before I move on? And don't feel like you have to if you don't feel comfortable.
Hi, Angel. This is Kathleen. I just put a note in the chat. I do think it would be best to have RTD provide an update at the future meeting. I wouldn't feel comfortable speaking on their behalf around the financial information. I think you covered it well, though, that they are facing a lot of severe financial hits from the COVID-19 impact. So I do think it would be great if they could present at a future meeting or provide a written update that you could share with the group. That would be great.
Okay. Yeah, and Natalie did say that she could send me the PowerPoint that they gave to the local government meeting, like during the local government meeting. Yeah.
Okay. Yeah, and that's probably a good start. I attended that meeting. There still were a lot of questions that came out of that. And so that sounded like a lot of things were still in flux. So yeah, I'm not sure the best way to get the latest information on it. It seems to be rapidly changing.
Yeah. Okay, well, hopefully we'll be able to get somebody who feels a little bit more comfortable giving the update next July. I know that Natalie said that she was reaching out to Pauletta's team. Another RTD update that I would like to make on their behalf is that the Access-a-Ride certifications have resumed. So as many of you know that like during the pandemic, they were not doing in-person certifications. So as for those of you who may be a little bit new to the transportation world, basically if somebody could not access the fixed route, they would be eligible for the complimentary paratransit service, which is called Access-a-Ride, but they have to apply for that service and they have to submit a doctor's letter and fill out the application form. And then they are scheduled for an appointment in Lakewood at Easter Seals. And Easter Seals has like a functional assessment, like kind of obstacle course type thing that they have people demonstrate that they cannot take fixed route. So I'm not sure exactly how that's set up, but they had closed down all of the certification assessments for about a month and a half or so, and they've started resuming those. So if people had applied for the Access-a-Ride service during the pandemic, they were given provisional certification, and now they're going to be scheduling all of those people who received provisional certification for the actual functional assessment. So, okay, thank you, Dinah. And then also, Eden, you had asked where this recording is available. We are only able to share it with internal people at this point, but I can talk to our IT people to see if I can download it and then upload it to YouTube and then post it on our website. We haven't done that to date, but I do think that it's something that since we have the capability of doing it, we could probably look into and send out. So Lisa Bitzer, are you on the phone? I know that you were going to give an update for VIA and then Zoe was going to give the rider survey. I know Lisa typically calls in on her phone.
Can you hear me now?
Yep, we can hear you.
Okay. Things are about the same at VIA. We've had a little bit of an increase in ridership. We're up to about 120 to 150 trips a day, which is still well below our norm pre-COVID, but it's better than the 45 to 75 trips a day we were doing back in March and April. So we're thankful for that. About half the rides that we do, I think we did a little over 3,600 trips in April, and about half of those were delivering groceries. So we've gotten quite good at the grocery delivering portion of what we do, picking up from community food share, also doing Boulder County Farmers Market. And then this week, we're going to start another program with the Boulder County Health Department, delivering CSA shares from Olin Farms to families in the Longmont area that they have determined need some produce and some food. So we'll start that on Thursday. I think that they had funding to get about 68 families. So we'll start doing that. And other than that, we just keep on doing what we're doing and picking up prescriptions, taking people for medical therapy, dialysis, and just, where there's a need, we're doing our very best to try to accommodate where people need to go, even if it's something we wouldn't normally do. We're trying real hard to help people get to what they need.
Great, thank you. I do have a question for you. I had attended like a national level accessible transit working group meeting, and they were talking about how they had adopted that grocery delivery model, and how as ridership increases, they were talking about eliminating that grocery delivery as they had more like transportation, like traditional transportation needs. What are you all talking about internally about that switch over, or if there is going to be a switch over from the bringing things to people model versus taking people out model?
I sort of think that it will always be around. I think that it will become less and less as people get more comfortable going out and feeling safe with their surroundings. But I think a lot of that also has to do with what happens with COVID. There's a lot of fear that, come flu season, it's going to flare back up again. And so I think right now people are being very cautious. And so it's something that we do because we definitely have the bandwidth to be able to do it. As things start to go back to normal, whenever that may be, I would like to keep it to some extent. I think it's been very helpful to the community. And of course, for our drivers, it's a lot safer to transport food than people, if they run the risk of COVID. So I'm hoping that we can keep it going long term. I think that a lot will depend on what happens with the world that we live in and what that looks like.
Yeah, great, thank you. Okay, so do people have any questions on Lisa's update before we move on to the 2020 Rider Survey? Okay, I'm gonna have to switch over here real quick, get to Zoe's PowerPoint that she sent me. Okay, we're ready for you, Zoe. Just let me know in advance.
Sure. So thanks for tuning in, everyone. We just completed our biennial writer survey. As you can see from the slides, we invited about 1,600 folks to submit a survey. Almost 300 did, and we had about a 17% response rate. Ready for the next one, Angel? Thanks. We won't spend too much on this. This is just a brief overview of who VIA's clients are. Most of our folks live in Boulder and Longmont. The majority of our clients who responded are over age 70. 40% use a mobility or assistive device. We have lots of female clients, primarily Caucasian, but we do have some Hispanic clients as well. Now, most of them live in their own private home. Most of them live alone. And most of them also have annual incomes below $25,000 with about 30% at or below the poverty line. All right, let's get on to the next one. So here's how our clients use VIA. They use it once a week. Sometimes they also walk or ride with RTD. A good deal of them, 40%, occasionally drive their own personal vehicle. And for a quarter of them, door-through-door assistance is absolutely essential, which is actually a little bit of a decrease from 31% in 2017. This word cloud here, it has some of the words that our clients use to respond with some feedback on this question. They love our drivers. That's why drivers is in that big bright pink. They like that our service is very helpful. We're really courteous. They really, really love our drivers. I'd say that's one of our strongest assets. So let's go on to the next slide. Here's why they didn't use VIA. For many, there are other transportation options available like Cultivate and Intelliride, and a significant amount of respondents did share that they frequently use their bike to get around. Now, some reasons why they don't use our service in particular, besides having other options, is they don't have the ability to get the pickup time that they want. I know that a lot of our clients have been wanting more evening service and greater weekend service, so that's a pretty constant comment that we get, which leads into we just don't operate during the times that they wanted to travel. Sometimes also they find some barriers in scheduling a ride. The need to schedule a ride in advance is a little tricky for some folks. We also have a punitive rule against same-day cancellations in our most typical sense. So that can be pretty hard, for example, for someone who lives with chronic day-to-day pain, and they're really judging, when they get up, can I get out? Like, is this something that's going to be a part of my day-to-day that I can do easily and safely and pain-free? So that's something that we are considering for the future as well. Yeah, let's go on to the next slide. Cool. So this here is a graph comparison. We want to measure the efficacy of our mission on our riders, and our mission is to increase the self-sufficiency and independence of older adults and people with disabilities in our community. Now, typically, we share with grantors that we're trying to get 95% or more of our riders agreeing that our service helps them become more self-sufficient and independent. And we clocked in at a nice solid 96% this time around. So doing pretty happy with that there. Now let's go on to the next slide. And the next slide is going to show a satisfaction comparison by year. So we've done this survey every other year since 1999 with NRC, the National Research Council. And I've got to say, we were really a little bit surprised that their satisfaction was so high overall because of the effects of, well, between COVID and generally decreasing the availability of rides over the last couple of years. However, many of our clients are just very grateful to have that service as an option. And their greatest satisfaction point was interacting with our drivers, and they were least satisfied with an inability to get trips when they wanted to. Let's go on to the next one. Great. So I wanted to highlight this question. If there was one thing VIA could do better to meet their needs, what could it be? And this might be helpful for everyone. So you might see that a couple of folks clicked other. For the folks who responded other, they just typed in all of these are important to me. So, but the most important one for them was having the ability to request a ride the same day. They also wanted expanded weekend service. Oh, and it's also important to them to offer more town-to-town trips. We've seen town-to-town trips increase, but I'm sure as many of you might know, those are pretty expensive instead of in-town trips. So that would be another thing we'd like to work on. In the long-term future, that might be something that Pantonium's software might help us with, but we're not quite there yet to test it out. So let's go on to the next slide. This one was pretty interesting. We did see that there was an increase in our clients' likelihood of using technology to interact with us and our services. It grew quite a bit from a couple of years ago. Now about 50% of our clients use a computer or laptop daily, have access to high-speed internet, and would use their smartphone even to schedule and manage their trip requests. One thing that does stand out is less than 50% were likely to conduct financial transactions online with us or through a smartphone. That might be based on some fear of where's my money going? Is my personal information with my finances secure online? And that might even be an indicator to create some educational pieces to share with our clients where does the money go? What's it doing, and is it safe, to kind of build confidence. It was really nice to see that more and more folks are using technology. And that is the end of my slides. I'm happy to take some questions and answer them to the best of my ability.
So Zoe, that is one thing that with the LIFT pilot program and also the technology education program, the payment online was definitely like a social cultural barrier to using new technology. So if you have any silver bullets on how to get people over that, let me know. I do know that there's a lot of education out there talking about not necessarily, they get talked to about like scams online and how like prevalent those are. So I do think that just the understanding of what's a safe transaction online versus what is a scam, maybe we could find some resources surrounding that.
Yeah, I think that's a great idea, Angel. I'm happy to share silver bullets with you, and I like the direction you're going in. Let's do it.
Yeah. Also, just so you know, I think that at least in the LIFT pilot with Josephine Commons, people felt more comfortable managing their money in cash, right? Because they didn't necessarily want an overdraft fee or something along those lines. So that was one of the issues, one of the questions that they would ask is if they could pay the balance with cash and then have mobility for all credits to cover like what the credits would cover, which of course you can't do at this point. But yeah, I do think that there's a tendency to want to manage your money using cash. So Jeff, let's see, there's some questions in the chat. So Jeff Johnson from Imagine said that he is suspecting that there's going to be more people who are familiar with technology due to the pandemic. And yeah, that is one positive thing. I don't know, Zoe, if you want to talk about the attendance that you've had on some of your town halls and the online engagement issues.
Sure. Well, we've had pretty mixed attendance. Some days we'll have as many as 30 folks come and join our online events. Other times we have a group of about 10. Scott, I don't know what percentage of our riders are Spanish speaking only. That might be something that Lisa Bitzer has available. And Lisa, feel free to jump in and answer Scott. And I've totally distracted myself. I'm sorry, where was I going?
So I think that we were talking, see, I lost my train of thought too, because I was reading Michelle's comment. Let's address Michelle's and then perhaps we can come back to that. So Michelle was wondering if you could pay online, like create an account where you can deposit check or cash and then they could draw that down versus using a credit card.
That is such a good question. And I'm not an expert in this, so I don't know if there's a better way, but I wonder if we could partner with King Supers or something. I know that they have bill pay. I don't know how that works. I've never done it before, but yeah, it might be trusted.
Oh, so she wants to clarify not an online account. So just like an account like in like with Via. So Peter, maybe you have some insight. I don't know if you're still on the call, Peter, because you all take checks for people who do not have credit cards. I don't know if you want to talk about that if you're still on the call.
We do on a very limited basis. And they tend to be more and more folks that were kind of grandfathered in before, we've been really pushing the online transactions with cards. But that said, our system is also set up so that people can make prepayments, which gives them a credit, and then they can just draw down from that. So they don't have to worry about, having to have a card for each and every transaction per se. But yeah, we do still take on a pretty limited basis walk-ins, checks, cash.
Okay. And also we, with the Lyft pilot, people were using PayPal instead of a credit card because they felt like that second step with PayPal, they were a little bit more familiar with it. And it helped them overcome some of the balance restrictions that Lyft had in place. So they didn't necessarily need to have $50 in their checking account because Lyft wouldn't double ping. Like they would ping to make sure that they had a current card on file with PayPal, but they wouldn't check to see how much of a balance was on that credit card, which that was, as many of you know, that was one of the biggest barriers that we had in the pilot was that by the end of the month, a lot of older adults on fixed incomes don't have $50 in their checking account to be able to cover the safety amount, even if we were giving people credits. So using third parties like that might also be something that some people might feel more comfortable with, but probably not everybody. Let's see what other questions we have. So Peter says they also accept PayPal with Ego Car Share. And then, okay. So Michelle's suggestion is being considered in the longer term accounts for clients, is what Lisa Curtis had said. Okay. So does anybody else have any other calls for Via, for Zoe or Lisa? Okay, thank you so much. And we'll go ahead and exit out of this. There's one more agenda item that we have, and it has to do with grant coordination. This one might be a little bit more interactive if you all feel comfortable unmuting yourself. So there's some grant deadlines that are coming up, and Via and Mobility for All, we met on Friday to talk about some coordination of our grant applications. Just so you all know, the Small Urbanized 5310 pot of funds is that grant application is due on the 22nd of June. And Via and Mobility for All, we have historically applied for that together. And then Mobility for All, part of my position and part of our operations are covered by that mobility management grant. And then there's also a July 6th deadline for a National Center for Mobility Management Community Mobility Design Challenge Planning Grant. And I wanted to talk about this a little bit more with you all, but I'll skip over that and we'll come back. The DRCOG Human Services Transportation Set Aside, that's the grant that Scott had mentioned that we're applying for the Lafayette on-demand service. There's one application per organization, but you can have multiple projects. And Scott, I don't know if Kathleen has talked to you about this, but I was thinking of tagging on to your application for possibly an RTD, like a study to find out if we could do the Easter Seals certification center, basically finding out how much that would cost to do one in Boulder County, but we can talk a little bit offline. I was wondering if anybody else is applying for this pot of money. Is anybody else applying for the DRCOG Human Services Transportation Set Aside? And do they want letters of support from the LCC? What projects are you considering applying for? Just so you all know, last year the city of Boulder applied for a grant, and then also Via applied for a grant. I think Via's grant was for the local match for some vehicle replacements, and then we applied for that Lafayette Flex Ride. Okay, so if anybody wants, Michelle said that the Longmont Senior Services is not applying for it, but she doesn't know if the City of Longmont Transportation staff is. So yeah, I can send you the link to the Dr. Cog grant. I think I sent it to Jennifer last LCC meeting. Basically, it's an extension, not an extension. It's designed for low-income households, older adults, individuals with disability, and it was federal dollars that were converted to state dollars, so they're using faster. So it's a little bit more open in the usage that you can, what types of projects you can actually use it for. And I think we can talk about it a little bit at our meeting tomorrow, Sue. I know that we have a meeting set up to talk about possible coordination with community cycles. So BTC said that they'd be happy to do a letter of support. So I'll put together some letters of support for different projects. This project right here, this grant application right here is one that I want to talk about. So mobility management is basically Mobility for All's type of programs, and VIA's type of programs, like where you, it's like case management for transportation. So this one is only $20,000, but it has like 2 separate iterations. So it would be similar to that inclusive planning grant that we got last year. The ideas that I had when we were talking to VIA is possibly like a health access partnership. So we could work with healthcare, and it would really be like that inclusive planning effort to really center the healthcare access as being the goal of like a working group. There's also employment opportunity. So maybe we could work with Workforce or DVR or the interagency transition team to really focus on employment access for underserved populations. And then there's also another idea, which Lindsay, I'm not sure if you want to chime in on this, but bike and recreation for older adults, people with disabilities, low-income households. That could possibly be a project that would be pretty competitive, because I don't know how many other communities would be focusing on bicycling. And I know that that's something that the Age Well process has heard a lot of. And I think that Lindsay might have stepped off if I remember.
She's here.
Oh, great.
Hello.
So I know that this is a project that the Aging Advisory Council has mentioned. I don't know how.
You know, that's interesting, but also I have to say that I'm interested in this health access partnership and thinking about how the AAA and others are involved in that as well, especially building on some of what the AAA has been doing over the years. And I know that our subcommittees would be interested in that as well. So both sound interesting. Employment opportunity, maybe some, I don't think there's as much AAA involvement there, but I'd love to talk more offline about ideas 1 and 3.
Okay, wonderful. And Rebecca, I don't know if you're still on the call. I don't know, since you have a DVR background, what do you think about the job access? Is Rebecca still on? And I'm not sure if Tanya Nolan was able to attend today. Are any of the municipalities really concerned with like one of these particular ideas? I see that Imagine's on board. Do you have any opinions on what sort of grants we could apply for the community design challenge? Okay. So I think that we're not necessarily going to get the dialogue that we would like in person on this. So if you want to be included in a smaller call to discuss applying for this this community mobility design challenge grant, let me know. The deadline is July 6th, so we do have like a couple weeks to really prepare it. But just so you all know, I will prepare a letter of support for the small urbanized, and then also the human services transportation set aside, and I'll send it out to you. If your organization wants to help support those 2 grant applications, then let us know. Yeah,
Hey,
Is there
Angel,
any-
it's Lindsay again. I was just
Yeah.
going to say one more thing too. That this biking and rec trails absolutely fits into the first domain of the domains of livability that we're really kind of building all of our strategic and action planning work off of. So we have, stated publicly, public spaces and infrastructure in Boulder County can be more age friendly. So I would really want to look at it from that lens. So if other folks are interested in talking more about that too, I'll put a little bit of information in the chat.
Yeah. So I do think that when we were doing the inclusive planning grant for the transportation master plan, there was a lot of interest around biking for seniors and individuals with disabilities. And in particular, like one of our inclusive planning meetings that we talked about this quite a bit, the lack of like support, not support groups, but like group rides and like group activities surrounding biking is something that some of the older adults were kind of lamenting. So I do think that between the inclusive planning steering committee and the work that you have done with the Area Agency on Aging, we would have enough support for to write this, enough background. And then for the healthcare access, us as like an LCC, we've struggled to get healthcare representatives, stakeholders on this committee. But I know the Area Agency on Aging has done a little bit more research on that, and we might have to rely on you pretty heavily for some of the foundational justification for that type of a project.
Yeah, I think it warrants a meeting with you and I and Carol to talk about what that might look like. Yeah.
Okay, great. And Elaine says especially e-bikes. And then Michelle said, please reach out to Phil directly about the grant and the letter of support. And then Rebecca said that she wasn't able to unclick herself or get into the meeting. It cut her off.
Okay. Sorry, Angel, this is Rebecca. I got back in. I heard my name and all of a sudden there was nothing.
Yeah.
So I didn't hear the question, sorry.
Oh, my question was, do you see, like from an impact perspective, or even from your DVR background, do you see potential in any of these three projects? So there's healthcare access partnership, there's an employment opportunity partnership, possibly working with workforce, DVR, and the interagency transition team. And there's also bike and rec trails for older adults, people with disabilities, and low income.
Yes, I know that we do, and as far as the health access partnership, there are issues in our more rural areas with both IDD and also other disabilities and gaining access. As far as employment opportunity, definitely.
Okay.
And biking and rec trails, not so sure, but that would be that would be something interesting to look at, to see how many, what population of the IDD population that is interested in those. That's something new for me.
Yeah, I do know that like 2 interagency transition team meetings ago, there was a discussion about like young adults who have IDD. They receive a bike through Imagine, perhaps, but the families, and they go through like a basic safety training course. But then, Anna said that the ITT has talked about bike safety.
That's very interesting because one of the parts of the needs assessment is to create more access in the community. So it would be very reasonable for it to be looked at.
Okay, so I don't know, Anna, if you would be interested in meeting with us as well from the ITT perspective.
Yeah, definitely. Yeah, we did talk about it at the ITT about the one of the problems seems to be that there's a lack of safety, needing to just be safe on the streets, that just saying this is how you turn left, this is how you turn right is not enough for our older adults or folks living with disabilities to be safe. And that's including regular bikes, e-bikes, tricycle bikes, tandem bikes, right? There's a multitude of ways that those bikes are being used now, and that there's an ongoing need for that continued training on safety on the streets Setting up routes would be another thing I think would be a really important thing, kind of like how VIA does travel training. If we did bike training where you were trying to go to your work or you're trying to go to your rec center or something, and helping you design the safest way to move from your home or wherever to those, to increase ability for independence in the community. So I think that's part of what we were looking at with the bikes. It's maybe increasing trails and maybe increasing groups, but there's that can't even happen unless there's a basic safety in being on both bike trails and bike paths, as well as on the streets in bike lanes. So that's what I think we were looking at. So yeah, absolutely. I think that's still a big area. And we did talk about that quite a bit. It might've been before you were joining us, Rebecca, because I think we started it even it was a while ago. So yes, thank you. That would be great. Thanks.
Okay, so I will send out a doodle poll to see who wants to be involved in this like coordination of grants applications. Just keeping in mind that there were a couple other grants that were also upcoming, but they didn't have like the imminent deadlines for the applications. So these were just the 3 that are available within the next month and a half or so. So so we can call it just like grant coordination meeting or something along those lines. And then we can just meet a couple times before they're due to flesh out that grant application, if that makes sense. And Michelle had asked if I can put the grant coordination slide into the chat. I will try to do that. If not, I will email it out afterwards to let you know. And just so you know, Michelle, the DRCOG Human Services Transportation Set Aside, last year the city of Boulder had applied for lift credits, or sorry, for a lift program to bring people to the senior centers. And Eden isn't on this call now, she had to jump off. But basically, since RTD had cut service to their senior centers, they were looking for a mobility on demand option to get to their senior centers. So if there's one particular site that you want to talk about, Michelle, or one particular gap that the senior center is seeing, I'd like to talk to you about that as well. Okay, so I will share this slide with you all. Does anybody have any needs that they've heard in their community, or any solutions that they heard or thought about during this meeting that they'd like to let us know about? Okay. Okay, great. I just want to thank you all for attending. Our next meeting is not June 8th. Sorry, I didn't update this slide. Our next meeting is July 13th. And so just to recap, I think that we will have a little bit more finalized idea of the grants, the collaborative grants that we would like to apply for. And then also we'll have an update from RTD just to hear that longer term like prediction on what service it'll be like. And if you guys have any questions on what else we should cover or any issues that you would like to address, please just let me know. Okay, great. Thank you all. And don't forget to put your name in the chat meeting, or the chat, meeting chat with your name and your organization. That way I can get you on our roster of people that attended. Thank you all. Have a good day.
Great. Thanks, Angel.
Thank you. Okay. I'm gonna turn off the recording.